And all I can see from the other side is if you look at the growing divide between rural and urban Canada, between small community Canada and downtown Canada, you see that the inequality in health provision is a huge issue. The fact that we can't get people to serve in rural, remote, and northern communities means that we can't get young families to settle and stay in rural, remote, and northern communities because what happens if their kid gets sick, right? I mean, so it has, the failure to deal with a health human resources issue has a whole lot of knock-on effects, which are very important. I'm very struck this summer as I went across the country on my Liberal Express tour, the number of times I was in a small Canadian town off the beaten track, and I would say, "What have you been doing this week, Mayor?" And the mayor, sometimes a man, sometimes a woman, would say, "Well, I'm trying to recruit a doctor, and we're trying to put the package together." And the package means, you know, we take them on a boat cruise of our local lake, you know, take them out to a good restaurant. We take her out to see the facilities. And you think, boy, this is a struggle. So we've got to figure out how we can partner with municipalities, how we partner with the provinces to make sure we get the health human resources issue dealt with and addressed for all Canadians. Our proposal is relatively modest, but it's a start, and we'd be open to work with anybody who's got a better idea to improve those incentives. I don't know whether Scott has something to add because he serves a rural community.
One of the roles the federal government could do is to help recognize best practices in some provinces and help other provinces try them and adopt them even in terms of pilot programs and where they can try new approaches. Some provinces, I understand, Newfoundland, for instance, Newfoundland Labrador does a good job in terms of nurse practitioners, is my understanding. Some provinces do a better care on home care. Some provinces have innovative approaches on mental health, which is something I think it's critically important that mental health issues play a more robust role in the upcoming negotiations. But I think the federal government can play a very important leadership role in helping provinces share and implement best practice models. Tommy Douglas said one time that provinces are great laboratories for public policy, and Saskatchewan proved that with ultimately a national program of Medicare. I think we can do a lot of that, and also identifying best practices in other countries and helping Canadian provinces implement them. So that's a creative form of federalism I'd like to see us try.
Let's have a question over here.
This question comes to us from Marge from the Canadian Home Care Association. She writes, "While home care is vital for Canadians of all ages, the changing demographics are the driving focus at the Canadian Home Care Association. As part of your home care strategy, would you support and invest in a Canadian repository of research on aging and/or a Canadian Home Care Research Centre?"
I think there's one of the things that I said in my opening remarks is that you're not just an organization of practitioners, you're a thinking organization with a research component. And we think that's crucial. And as I went across the country this summer, I went to a number of centers in Canada where they're doing vital research on geriatrics. Not just brain chemistry, but they're also doing research into best models and best practices of care. And in fact, as I walked in this morning, I met one of you who is a nurse scientist. I thought that was a great combination. We need more nurse scientists. I think there's no question, following on Scott's thought, one of the key functions of the federal government is to incentivize, coordinate, and make known best practice across the country. One of the most important functions of a federal government is strategic research in issues that matter crucially to Canadians. There is no area which matters more crucially to the future sustainability of our economy and society than research into aging, not just into the neurology of it, but also into the best practice, which is why we've said we've made a commitment to a national brain strategy. We believe very strongly that Canada has, just let me take the Alzheimer's side of it, but not just Alzheimer's. There are other neurological conditions that are having a devastating effect for families. And we've got scattered across the country some of the world's best researchers. And they've come to us and say, let's have a pan-Canadian brain research strategy driven by the federal government, sustained over the long term. That would be one piece of it. But I don't want to neglect the best practice in nursing and care side of it either. I think we've learned as I've gone across the country that in place after place there's innovation in how to use exercise, diet, nursing strategies to prolong mental alertness, to sustain physical fitness. These things are absolutely crucial. Having had a family who has had 2 generations of Alzheimer's, I noticed just in my lifetime that basically my grandmother, we basically locked her away. My mother, very different. Franz Kafka said, "There's hope, it's just not hope for us." Those are cruel words, but they're wise words. We have to believe passionately that even if there isn't hope for us, or hope for our mom, there's hope for our children and grandchildren. And it's that kind of long-term strategic commitment to fight for hope here in terms of treatment, care, and research. We just have to have a federal government that says, this one really matters. This isn't just another dancing bauble that a government lunges after. This is so important, brain research, for the future sustainability of our healthcare system, for the capacity of families to care with the devastating impacts of these illnesses, that we just, we're going to step up here. And it's not just because of my personal experience. You just look at the statistics here, and you know how much this matters to Canadian families. So I hope that answers the question. Thank you. I think we got time for one here and one there, and then we're going to have to wrap it up. Ma'am.
Good morning. I'm Laurie Cooper. I'm District Executive Director for Community Support Services in Southeastern Ontario. Mr. Ignatieff, you mentioned the SMILE program a few moments ago, and that's seniors managing independent living easily. So for frailer seniors to manage that independent living, they also need access to practical supports for daily living. Help with housework, laundry, some of those very practical supports, and we have some evidence to show that that's working, that's being effective in helping seniors remain at home. And just wondering if you could tell us about your plan to ensure that those services are available to seniors and their caregivers as we go forward.